Good morning, nursing students. It's Mrs. Stiefvater, and I have my handy assistant, Miss Alice, and we're going to show you some different oxygen delivery devices that you might encounter during simulations during the nursing curriculum at HCC. So first, just remember, oxygen's a drug, and just like any drug, you need to ask yourself, why is my patient getting oxygen? And two, just remember that you need to realize there are associated hazards. So review in your textbook what are the hazards with giving a patient oxygen. So let's get started. First, we want you to know that the head wall units in simulation are actually functional. They work, guys. So there's no saying I would. We want to see you do. Miss Alice is going to show you how to pop an O2 head in. It just snaps. And look, you can actually turn this on, okay? So let's say that the physician said, let's use a nasal cannula. This is a nasal cannula. There are prongs associated with a nasal cannula. It connects to the O2 head in what we usually call a Christmas tree. And let's say that the physician says, okay, let's put this on at 2 liters. Okay, so we turn it to 2 liters, and Miss Alice is going to show you how to appropriately apply the nasal cannula to the patient. Now, while she's doing that, nasal cannulas can go anywhere from 1 to 6 liters. And so we're putting our patient on 2 liters. But realize that when you get to about 4 liters or above, it's really drying. It's very irritating to the nasal passages. So we might want to consider adding a bottle of what we call humidification. Okay? When you have to add humidification, then what we need to do is actually turn the oxygen off, take the Christmas tree off, apply the bottle. And this bottle is full of water, and then apply the nasal cannula, and then we would turn it up to the desired amount. Okay, so that's a nasal cannula. Next, we're going to move on to a face mask, just a simple face mask. And as you can see, a simple face mask, it's pretty self-explanatory. Miss Alice is going to put the Christmas tree back on. And while she's putting the Christmas tree back on, I'm going to show you that a simple face mask can run between 5 to 8 liters and provide approximately 40 to 60% oxygen. So a simple face mask runs between 5 to 8 liters and can provide 40 to 60% oxygen. So it connects just like the nasal cannula, guys. Connect it to the Christmas tree. Let's say that we have been ordered 5 liters, which would give about 40% oxygen. She's got it on 5 liters, and she's going to apply it to the patient's face. And then, of course, you know, once you change oxygen therapy, you need to say, hey, I need to reassess my patient. How do I know if this oxygen, which is medicine, is actually working? So we would want to look at our patient. We would want to check our O2 sat. We would want to check our respiratory rates. Let's listen to our lung sounds, okay? And so here's your O2 sat. We would go ahead and make sure that we would apply this to your patient and see if the oxygen therapy that we are actually using is working. All right, let's move on. Just gonna mention this particular device. This is a Vinny Mask. A Vinny Mask a lot of times gives a very specific amount of oxygen, and sometimes is used for people such as COPDers, where we're really concerned about what % of oxygen we're actually using. So when you have a Vinny Mask, you can see it's very simple, very similar to a simple face mask, but it comes with multiple adaptive devices of different colors. And if you look at these guys, you can see that on the end of them, it actually tells you how many liters to set the mask at, and then what % of oxygen that delivers. So let's say that the physician said 40%, well then we pick the pink, and when we pick the pink, we look at the bottom of it, it tells us that we want to set it to 8 liters, okay? As compared to if we chose the yellow says that
4 liters.
4 liters. So that's on the end of each adaptive device, and that's the Vinny Mask. Next, we're going to do the non-rebreather mask. Now, the non-rebreather mask is used for someone whose oxygen level is dropping quickly and is getting into trouble. But you have to specifically utilize it in a certain way. Miss Alice is going to connect the non-rebreather to the Christmas tree, and then she's going to turn the oxygen up to 15 liters. So she's turning the oxygen up to 15 liters, and notice what she's doing. She's filling the reservoir. She's filling the bag so it's full of oxygen. If we skip this step and put that bag collapsed onto the patient, then they rebreathe their own CO2. The bag is nice and full. She's going to apply it to the patient, and every time the patient takes a breath, they get a nice full breath of oxygen. Okay? Now remember, you must follow up and see what the O2 set is, and remember, you leave your O2 set at 15 liters. This is not one of those bags where we then take it back down. So leave it at 15 liters. So we're checking the O2 sat to make sure that the oxygen that we've applied is working. We're counting the patient's respirations. We're watching, are they using accessory muscles? We're looking to see if there's any kind of nasal flaring, and we're listening to the respiration. Last but not least, I'm just going to mention the Ambu bag, or sometimes you guys might hear this called the bag valve mask device. You guys might have seen this when you took your CPR class, okay? Now, this device is utilized in an emergency situation. It's utilized for a patient that is having agonal respirations, which means their respirations are not going to support their respiratory function, or they're not breathing at all. And we need to assist them with the depth and rate of their respiration. Now, most of the time you're going to need this mask. And this mask just fits right on, and then you'll see the shape of the mask. It pretty much shows you how it would go across the patient's face. And so we have the bridge of the nose and the chin. So this is the bridge of the nose, and this is the chin. Okay? Miss Alice, once again, is going to connect this. You can see it also has a reservoir bag. She's cranking it up to 15 liters. This patient is either experiencing agonal respirations or possibly not breathing at all, and she's going to assist them. So the more slender part goes over the bridge of the nose, and the fuller part goes on the patient's chin, and then she's going to provide supplemental oxygen and supplemental breaths. So this would only be used in a scenario if you have a patient who has agonal respirations or is not breathing at all. That wraps up our video. Thanks for watching, guys.